Welcome to the Perinatal Mental Health Virtual Roundtable. Thank you all for being here. This panel is made possible by support from the Family League of Baltimore and in partnership with Be More for Healthy Babies. May is Maternal Mental Health Awareness Month. And the focus of today's roundtable is perinatal mental health, which refers to the prenatal period and postpartum. While postpartum is most commonly thought of when discussing maternal mental health, it is important to acknowledge that mental health conditions can develop or become exacerbated during pregnancy as well. Additionally, the term perinatal is gender inclusive, as not all who are struggling with their mental health during the perinatal period identify as mom. 1 in 5 of those who are pregnant or postpartum will suffer from a maternal mental health disorder such as anxiety or depression, but only 15% receive treatment. Perinatal mood disorders are one of the leading complications of pregnancy and childbirth. The goal of today's roundtable is to build awareness of perinatal mental health within Be More for Healthy Babies partnerships, the BHB network, and in Baltimore City overall. It is a vast topic that we will not be able to cover fully today. However, we aim to use this opportunity to center the conversation around perinatal mental health and to raise awareness about the importance of this topic in our work with birthing people and families. We will have time for attendee questions during the final portion of today's event. So please leave questions in the chat and we will do our best to get to each question at that time. Please be advised that the conversation today will include the discussion of sensitive topics related to mental health, such as self-harm and suicide. So please be gentle with yourselves and take care. I would like to give thanks now to the Be More for Healthy Babies team and partners, as well as the Family League. I'd also like to give special recognition to Jen Kirshner, Director of the Prenatal Postpartum Behavior Health at the Bureau of Maternal and Child Health, for providing support and helpful resources while planning. And another special thanks to Stacey Stevens, who was the first person I spoke to when we began planning and connected us to one of today's great panelists. And many thanks to Family League's data and evaluation team for assisting with the evaluation for today's event. Thanks also goes to Crystal J, one of our awesome panelists today, who designed our flyer that you can see right here. Finally, I'd like to thank our moderator for today's conversation that I now have the honor of introducing. LaDawn Black is a communications professional, author, and media personality who has been featured on many local and national media outlets. She was the host of the top-rated late-night radio show, The Love Zone, and was most recently the host of the LaDawn Black Show on New York's legendary 107.5 WBLS. LaDawn is currently the communications director at the Family League of Baltimore, and we are very, very lucky to have her on board. Connect with her on Instagram at Tease by LaDawn, and she has been just absolutely instrumental in planning this roundtable, and I'm just so grateful to her for moderating for today's event. Thank you, LaDawn. And now please welcome our moderator, LaDawn Black.
Well, Nina, thank you so much for that intro. I'm excited to be part of the Family League team and advancing the things that the Family League works for to improve the outcomes for infants, youth, and children here in the city. So let's just jump right in because we have so many people that want to engage in the conversation today, and we have fantastic panelists. So let's just go ahead and introduce our panelists. First up, we have Crystal J. She's the founder of For Dope Moms. She's the owner and graphic designer of HausEleven Design Agency. Having worked in graphic design for over a decade, Crystal J is an incredibly versatile and talented individual. She holds several professional roles, including the owner of HausEleven Design Agency, creative director for OIA Brand and Bent Wine Company, as well as founder of For Dope Moms, a new community that curates events and experiences for mothers to connect and make time for themselves. A mother of 2 beautiful brown girls, Crystal J is a creative at heart, creating dope vibes for brands and making waves for moms everywhere. So welcome, Crystal J, to the conversation.
Thank you. Hi, everyone.
Our next panelist is Nicole Barnett. She is a maternal mental health advocate and perinatal mental health counselor at the National Maternal Mental Health Hotline. As a licensed clinical social worker, Nicole Barnett serves as a perinatal mental health counselor with the National Maternal Mental Health Hotline. This hotline provides brief psychosocial intervention, support, and resources to expecting and new mothers experiencing mental health concerns. Nicole is also a postpartum depression survivor. She is engaged in a variety of maternal mental health advocacy and education efforts over the last 15 years. She recently served as a member of a working group convened by the Maternal Mental Health Leadership Alliance and March of Dimes. This group assisted in developing a recommended framework for when to provide maternal mental health education and training during pregnancy and the first year of postpartum. Nicole is passionate about raising awareness of maternal mental health conditions in communities of color, as well as improving equity in the treatment of these conditions for women of color. Let's welcome Nicole to the conversation.
Thank you. So glad to be here.
And our final panelist is Shelly Bray. Shelly Bray is the manager of the M. Peter Moser Community Initiatives Department at Sinai Hospital. Prior to her current role, Shelly was the coordinator of the Perinatal Depression and Anxiety Outreach Program. She is passionate about maternal mental health and has been a clinical social worker for over 15 years. Let's welcome Shelly Bray to the conversation.
Hi, thanks for having me.
All right, ladies. Well, let's just go ahead and jump into it. And basically what I want to do is start out by talking about each of your individual areas and getting a better sense of where you work in this space. So let's start with Shelly. If someone joins the postpartum support group, what can they expect?
Every support group I think is different, but I can definitely speak to the support group at Sinai Hospital. A support group is what it sounds like, a support group. It's there to provide support for the members of the group. When I was facilitating the group at Sinai Hospital, the best groups are when I didn't talk at all. The best groups are when all the members talk to each other. They barely know I'm there, because that's really what it's for. It's for members of the group to support each other, talk about their experiences, what they've been through, how they got through it, and things like that. And if someone's worried about joining a group, or they want to know what to expect, or they're just kind of curious or a little nervous about it, I would always tell them, there's no pressure. You can come and join. If it's a virtual group, you can turn your camera off. You don't have to speak. No one was ever forced to speak. Come back and check it out. I think that, and I'd always tell people, I think if you check it out, you're going to want to come back. Most people do, but also I'd always tell people there's other groups in the area too. So really, as mental health in general, you have to find the right fit that works for you. So there are lots of groups out there. There's a lot of online groups, not just Sinai. There's a lot of other groups in the Baltimore area as well. And the important thing is that you find the right fit for you and the right group for you and the right mix of people. But I will say that being in a group, people in our group would come from all walks of life, all different walks of life. And I would sometimes think, gosh, I wonder if some of these mothers will connect. Everybody always connected because they were all in a special group called motherhood that you just cannot know what it's like until you actually go through it. And it is so important to have supports when you're going through it.
Well, Shelly, thanks so much for sharing that. And I guess if you're comfortable, I'll share. I'm a mom of 3. So, this issue actually means a lot to me because a lot of times I felt, with each of my pregnancies, like I'm the only person out here that's feeling this way and nobody else feels this way and I'm alone. And sometimes you're alone when you have supports as well. So if you can give us a little bit of an insight into why this area was an area you decided to work in.
We say that we're all done. We say that we're all done.
I think someone's not on mute, but can you hear me?
Yes.
Okay. So for me, like you said in the beginning, I've been a clinical social worker for about 15 years, and I love mental health, and that's my background. And when I came to work for Sinai Hospital, I became aware of we have a perinatal depression and anxiety outreach program here, and I never knew.
One second, Shelly. We would need everyone on mute. I think there's a participant by the name of Sashina. There we go. Thank you.
That always happens. That's happened to me before. So when I came to Sinai Hospital, I didn't even know that there was an area where you could just concentrate on perinatal mental health or maternal mental health. And so I found out about that program and thought, oh my gosh, this would be so wonderful. I'm a mother myself, and the two of my favorite things in my life are my children and being a mother, and mental health and mental health awareness. So it combined those two. And when I got into, what the opportunity became that I could become the coordinator of that program, it was just a great fit because it is so important to spread awareness about maternal mental health and perinatal mental health. It's so common, and a lot of people don't know how common it is. So I just felt like it was it became a passion of mine. And when I was starting that as a coordinator, I came across a quote online that was sort of the tone of that support group and the tone of the program. I don't know who the author is, but I always have it posted. It's, everyone wants to hold the baby, but who holds the mom? So I just felt like that it's so true. Who holds the mom? Who's there for the mom, especially with mental health? So that kind of became my passion for that program.
Wonderful, Shelly. Thank you so much for sharing. Let's move on to Crystal. If you could give us a feel for how you sort of stepped into this space, what your personal connection is, and also tell us all about For Dope Moms.
Sure. So one, I just want to say thank you again. Thank you, Nina. Thank you, Tamara, for even suggesting me to be a panelist. This is something that is very new to me, doing these type of things. So I'm excited to be here. So thank you. But yeah, and it's funny because I was designing for Family League last year around this time for one of their campaigns. And I never thought I would be in this space right now. But a couple of years ago now, I think we're in year 2, I started For Dope Moms after suffering from postpartum depression with my second daughter. I have two beautiful little girls, a 10-year-old named Kennedy and a 4-year-old Brooklyn. And when I spoke with Nina, when I first had this conversation with joining as being a panelist with this event, the beginning, we started talking about the experience I had with Brooklyn, but I said the experience that I had with Kennedy was also very, very traumatizing for me. So both of my pregnancies, they're both really interesting and powerful stories that I love sharing with other mothers. But to go back into starting For Dope Moms, after I was dealing with postpartum depression, I just knew, while I was in that stage, that chapter, I wasn't the only mother going through that. And it was hard at times for even myself to kind of pull myself to motivate my own self to get out of that funk. It's really hard to even categorize how it feels. But I just knew I wanted to connect with other mothers and also create a platform to have other mothers connect with each other so that they can share what they experienced through these difficult times. So for me, one of the things I love doing is throwing events. And I feel like healing comes in all different forms. We can dance, we can laugh, we can go to a happy hour if we need to. But creating these type of events where mothers can come and join and connect while having a good time, I feel heals us all. And that was really one of the reasons why I started For Dope Moms.
Wonderful. Crystal, thank you so much for sharing. So Nicole, tell us your personal connection to the topic, but also give us some information on the hotline. Why was it created and what has been the impact so far on the community?
Sure, thank you. I'd be happy to. I'm so excited to be here today. And I would like to thank Stacey Stevens with Be More for Healthy Babies for connecting me to this roundtable, and to Nina. It's such an important topic, and I appreciate each of you taking the time to be here today to learn more about how you can be part of the solution and help for families who may be struggling with these issues. And I am a clinical social worker by profession, as was stated, but I do come at this work from a personal connection as well, having experienced postpartum depression after the birth of my third daughter over 15 years ago now. And after that time, I started engaging in maternal mental health advocacy and education over the various years, and that has culminated in me having the wonderful position of serving as a counselor with the new National Maternal Mental Health Hotline. The hotline had its official kickoff on Mother's Day last year. So we just recently celebrated our 1-year anniversary. The hotline is funded by HRSA. It's a federal hotline, but it is a free confidential hotline that can be reached by phone or by text. It is available 24/7, 365 days a year, and it is staffed by licensed counselors or licensed professionals who have all had specialty training in perinatal mental health. And there are about 35 of us that staff the hotline, and we provide emotional support, brief psychosocial intervention, resources, and referrals for pregnant and postpartum individuals, as well as their family members or friends can call in as well, partners as well. We are here for it for everyone that's experiencing this situation. We are able to speak to callers or texters in English and in Spanish. We have Spanish counselors, as well as we have the ability to use a translation service that will allow us to communicate in over 80 languages. So that is available as well. We have had a great first year in terms of fielding more than 13,000 contacts, most of them calls, but by text. Always let people know that you will be communicating with a live counselor when you call or text. It's not just a voice, or it's not just someone texting back rote responses to you. You will be reaching a live person. Many of us on the hotline all have our personal stories with experiencing postpartum depression or some other type of maternal mental health condition. So we come at this work with great passion and a great desire to make a difference in changing some of these horrible statistics really that exist with pregnant and postpartum persons as well as their families.
Wonderful, Nicole. Thank you so much for sharing that with us.
Sure, and I actually should share, I'm sure it's going to be shared as well, but I want to share the number.
Yes.
And note this, at our year anniversary, we actually kicked off a new vanity number to try to make it a little easier for folks to remember. Our number is 1-833-TLC-MAMA. So TLC like tender loving care, mama, MAMA. That translates to 1-833-852-6262. So if you take nothing else away from today in terms of a resource that you can connect families to, the National Maternal Mental Health Hotline is a great place to start.
Nicole, thank you so much for providing the phone number, because that's important. I mean, there's no point in having a hotline if no one knows how to reach it. So thank you for that. Well, you are on the, we're just going to start with you, Nicole, with the first question. Are you ready? Okay, let's talk about the different conditions that fall under perinatal mental health. What are some of the most common mental health conditions that you see?
Yes, I'm really glad that you asked that question, because sometimes we hear the term postpartum depression, and it is used as a way to kind of encompass all types of maternal mental health conditions. But in reality, that is only one of the perinatal mental health conditions that exist. And just to sort of name some and describe sort of briefly, oh, thank you. Nina is providing a wonderful graphic for us here for me to just sort of briefly run through these. This came from Postpartum Support International, which is another great organization that I'm sure you're going to receive contact information for. And these conditions, as noted already by Nina, we call them perinatal because that simply means occurring any time during pregnancy through the first year postpartum. So we can have perinatal depression, which is going to present itself as classic depression. All of these conditions are experienced by the greater whole population. But in this case, these symptoms and conditions are being experienced anytime during pregnancy and the first year afterwards. And even couple of more years after that can be the experience for some moms. And so when we think about depression, that's going to come with symptoms of moms having low mood, low energy, sadness for no reason, feeling exhausted and tired, having negative thoughts, Also sometimes difficulty with changes in eating and sleeping, as well as just they're not as interested in the normal things that they would normally be interested in. And this would be sort of outside of becoming a new mama. One of the colleagues in this field, she likes to say that the basic personality of a mom should still be intact at some point after having her baby. But if we're not seeing that within the first 2 or 3 weeks after a mom has had her baby, then that's when we become more concerned. And I'm actually going to back up and share more about what I said about the 2 to 3 weeks. It is common for 80% of birthing people to experience what we call the baby blues. And that is simply a 2 to 3 week time period where mom might be a little weepy. She's adjusting to being a new mom. There's all these new pressures. She might be feeding through the night. She's tired. She's getting lack of sleep. That's something that's normal, and it should dissipate on its own within the first 2 to 3 weeks. But outside of that, once we get past that time, if mom is still struggling, then we want to be concerned about some of these conditions that are listed here. So I already described depression and perinatal anxiety, which simply present itself more as moms who are having excessive worries, excessive concerns. If you can imagine COVID, right? And all the extra worries that brought on for parents. And these parents are also may experience more panicky type of conditions or panic disorders where they're literally experiencing panic attacks. They may feel like they're going to die. Their heart might be beating out of their chest, or they may have sweaty palms or feel dizzy or feel nauseous. So if a mom is sort of describing some of these terms to you, she may be experiencing postpartum anxiety and then the panic disorder that I just mentioned. Next, we can have perinatal OCD, obsessive compulsive disorder. And this is going to look like moms who have what we would call unwanted intrusive thoughts. These thoughts are oftentimes scary. They may be images or thoughts of the mom herself hurting or harming her baby in some type of way that they would never do. One of the classic examples might be a mom visualizing her baby falling down the stairs, or that mom actually having visions of her own, or thoughts, if you will, stabbing her baby, those types of scary thoughts. And we hear all of this on the hotline. We let our callers know that they're not going to tell us anything that we have not heard. But these obsessive thoughts are unwanted thoughts that these parents are experiencing. They don't want to act on them. But if you can imagine how scary that is to have those thoughts coming into your mind and feeling like you're going crazy and feeling like, what mom thinks this way, feeling the shame and embarrassment of, how could I possibly thinking about harming my baby or seeing my baby hurt in this type of way? These obsessive thoughts can sometimes come with compulsions that the parent then does to try to sort of get rid of the obsessive thoughts. So there may be obsessive thoughts about germs and the baby getting sick from food or from the bottle, it's not sterilized. And so these parents might obsessively or compulsively wash bottles, sterilize, clean everything all the time, not trust other people to feed or care for their baby. So it's sort of a two-punch. You have the obsessive thoughts, and then you might have the compulsions that come that are trying to kind of combat the obsessive thoughts. Next, we would have postpartum PTSD. PTSD simply standing for post-traumatic stress disorder. We hear about this from in the veteran world, but similarly, in the postpartum period, many times births can be traumatic. They can be traumatic for mom, and we sort of like to say that trauma is in the eye of the beholder. Some moms, actually, their lives are on the line. They could possibly have died in childbirth. They have many conditions after childbirth that are traumatic. And then also when babies are born early and have to spend time in the NICU, this can all be very traumatic for a mom. People who are delivering might also have experienced trauma such as sexual abuse or physical abuse even before delivering their child, and this crops up for them after delivery. So moms can experience, new parents can experience post-traumatic stress disorder, and it is considered a perinatal mental health condition. Then we have bipolar disorders. Bipolar disorder, especially if a parent or if a person has already experiencing or already has a diagnosis of bipolar disorder, they're definitely at greater risk for this rearing its head or perhaps intensifying after delivery. So we definitely want to be concerned about anyone who has a mental health condition even going into pregnancy, that it can heighten during that time or heighten after delivery. The hallmarks of bipolar disorder is moving from extreme highs to extreme lows, or we might say mania or depression. So we see in these parents, either during pregnancy or postpartum, that they might feel like they don't need any sleep for 3 days. They might paint the whole house. They feel like they can take on the world. They don't need any sleep overnight to care for their babies. And then maybe the next week, they are down, 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 low in the dumps, can't get out of bed. Life is terrible. Why am I here? So swinging back and forth between highs and lows. And then the last one that's noted here is something that is also often confused with postpartum depression, largely because of the media. Oftentimes when we see cases of what is known as postpartum psychosis, it gets labeled by the media as postpartum depression. And that is really a misnomer. Postpartum psychosis is one of the rarest of the conditions. We don't know the exact rate, but some studies note it as anywhere than less than 0.1% or 0.2% of moms experiencing this, or birthing people experiencing this. And what the hallmark of this is, moms in this position are going to have lost touch with reality. We're looking here at those who are experiencing delusions. They may be seeing hallucinations. They may be hearing voices that are telling them to harm themselves and harm their babies. And in this case, these parents believe these thoughts. It's not at all like with the obsessive thoughts where the mom is horrified by them and doesn't want to do them. In postpartum psychosis, these thoughts make sense to the parent. And so they feel that they're hearing voices that might say, drown your child, or stab your child, or kill your child and yourself, right? And those thoughts make sense to them because of the delusional state that they are in. When moms are starting to speak in this kind of way, or you start seeing moms with this kind of experience, this is an immediate medical emergency where you need to get that birthing person to the hospital right away. That is the safest place for them, because we don't want them to take their lives, nor do we want them to take their child's life or anyone else. So we often see that in the news. There's been some cases recently where we're getting more education and getting know more about postpartum psychosis. But please don't confuse this or say that it's the same as postpartum depression, because then that can be scary for a mom who might just be experiencing depression, but she might think, oh my goodness, I'm going to kill my baby, or I'm going to harm myself. So it's important to keep these distinct. And I'm so glad that you showed this slide so that we could get a brief overview of all of the conditions that can exist.
Oh, thank you so much. Shelly, I'm going to jump to you and ask you, what are the risk factors for someone to experience perinatal mental health challenges? You know, are there certain communities, certain situations that seem to sort of, increase the opportunity for this?
Mm-hmm. Well, thank you. Like Nicole mentioned before, having a history of mental health history just in general puts you at higher risk of experiencing it during pregnancy or in the postpartum period. So that's one of the biggest risk factors. She mentioned postpartum PTSD. So having something occur during delivery, or having a NICU baby, unplanned C-section, other reasons for experiencing PTSD can put you at risk for experiencing the postpartum PTSD. Having a family history, a maternal family history of postpartum depression or anxiety can put you at risk. So knowing, if you're able to, knowing what your own mother experienced, if she had any postpartum depression or any postpartum mental health issues, that does put the birthing person at risk as well. And anything, really having a general history of it, and also having experienced postpartum depression or anxiety and any other pregnancies also push you at a higher risk of experiencing again. It doesn't mean you will, and I always tell people, it doesn't mean if you have a higher risk, all it means is you just need to be aware, a little bit more aware, and have a plan, because each baby is different, each birth experience is different, each, like when you're having another baby, you're maybe in a different place in your life. So it doesn't mean you're going to experience it again. It just means to have a good plan in place to know what to do if you experience it.
Shelly, thank you so much. So Crystal, I'm going to ask you, in your work with For Dope Moms, what is it that keeps people from getting treated when they recognize that they have some of these symptoms?
I think, and this is personal because this happened with me, I think we're scared. And I think when you're a new mom, especially, you are thinking this is going to be a beautiful experience, and you don't really know, especially if you're not educated, you don't know what is to come. But when you do get into any of these situations, you get scared, honestly, and you might shut down and be afraid to talk to someone about it, because you want to still be in that, I just had my baby, I need to be present. This can't be happening to me. That's how I felt. Like, this can't be happening to me. And I kept saying that, like, I'm not going to let this happen to me. But it became overwhelming. So I think for a lot of mothers that I connect with, that's the first thing they always say. They're scared. They're scared.
Crystal, thanks so much. And so I'll open it up to the full panel. Any final thoughts on risk factors and why people choose to go untreated?
Sure, I would definitely add some risk factors. Shelly noted the most important one, having a prior mental health history. But we also know that greater risk are NICU parents whose babies end up spending time in the NICU. It's very stressful for your baby to come early and have to spend time there. And then parents that lack support. So this could be immigrant parents, single parents, teen parents, parents that might not be getting that practical help when they become a new parent. We also see parents experiencing perinatal mental health conditions if they've had a former history of infertility or child loss. Sometimes all of that goes into finally getting this baby here, right? And then afterwards, maybe a letdown or all of the anxieties and worries that come with that. So that's another population that can be at risk, that as you work with your families, you want to sort of be sensitive to those things. And then I love what Crystal said just now about fear. I think that is just such an overpowering factor, and maybe not wanting to accept that this is happening to you. We unfortunately, especially in the Black community, have this thing of Black women are strong, they're all powerful, they are superwoman, they can do all things, and that we are not supposed to ever go down. We're not ever supposed to feel it. And having a baby is supposed to be the happiest time of your life. And you should be happy, or you tried so hard to get this baby here. I love somebody just put releasing the cape, right? Like, stop, with us, stop being super mom. But all of that mentality can then make us fearful of realizing or accepting, I'm struggling and I need some help here. And then on top of that, you have just the general stigma that is related to mental health conditions as a whole. It's either we don't talk about people because, they're crazy, it gets labeled as craziness, or either we just ignore it and press our way through and press our way forward. On another end, we often talk to moms on the hotline. They feel like they're by themselves. They're the only person experiencing this. So because they're just not aware that this is common. This is the number one childbirth complication, is experiencing a maternal mental health condition. And unfortunately, the CDC just cited and released a study that says that maternal mental health conditions are also the number one cause of death during pregnancy and the postpartum period. And that should really sober us. That in the United States, that new moms, pregnant and first year new moms, are dying from suicide and overdose. Those are the two things that are combined that make that stat. And so it's just overwhelming. Someone was saying, say that again, Stacey's saying that again. It's very sobering that maternal mental health conditions are the #1 childbirth complication. This is over hemorrhaging. This is over gestational diabetes, of everything that can be a complication. Maternal mental health conditions are #1, and then during pregnancy and the first year postpartum, the #1 cause of death. And so we do want to be in a space where we are encouraging getting past this stigma and saying, it's okay. It's more common than you think. Go to get some help. Some other fears that I hear moms express is fear of losing custody of their children. If they've had any type of history, maybe where they may have lost their children before, or just simply they're thinking, I'm going to go to the hospital. If I say what I'm thinking and how I'm feeling, they're going to take my kids away. And unfortunately, we see a disproportionate reaction to women of color when they present themselves for medical care. It gets attributed either immediately to substance use or immediately to poor parenting, instead of taking the time to say, this parent is pregnant, this mom is pregnant, and she's postpartum. Maybe it could be something else. So fear of losing custody is another reason. And then we just look at all the social determinants of health that impact women, and especially women of color, getting treatment. Even if you realize something is going on, it may be very difficult for you to get treatment. You may not have access. You may not have transportation. You may not be able to take off your job to even go. There's so many things that can prevent seeking and looking towards getting the help that you need, or feeling like you'll even connect with a counselor or provider that will help you. So as community workers and home visitors, you all are on the front lines to help combat some of these things, to talk to these families and parents, to let them know it's okay. And I promise you, it is better for you to get help now than to wait for any condition that I just mentioned to get worse. And it's always directly to the hospital if it is a psychosis case where mom has experienced delusionals or threatening harm to herself or someone else.
And Nicole, I'm sorry. No, that was great, Nicole, because everything that you have said is something that I really experienced. I remember talking to my therapist and saying, I'm scared to tell you what I'm feeling because I don't want someone to come and take my babies away. And that's a real thing that is going on, especially in the Black community. But I just wanted to touch on that.
Sometimes when I talk on the phone to people, I'll even say that. Does it mean, are you having suicidal thoughts? Believe me, I talk to a lot of people that have suicidal thoughts. It doesn't mean you're going right to the hospital. It doesn't mean somebody's taking your baby away. All it means is you need help right away. That's all. It doesn't mean, it means we can't wait. We can't wait a couple weeks to find you a therapist. It means let's get you an appointment tomorrow. I say it out there and I just put it out there. And then maybe the next time I talk to them, I'm going to let her know. I'm going to be a little bit more honest this time. But I do hear that a lot too. And people are surprised at how common, other moms have suicidal, and it comes up in groups and things like that as well. Like I'm not the only one having it.
Wonderful. Thank you so much for all of your comments. So to sort of piggyback on where we are in the conversation, let's talk about those barriers. We talked about transportation. We talked about insurance. We talked about the knowledge of providers. Let's go ahead and take this over to Shelly. Can you talk to us a little bit about some of those, systemic barriers that keep, birthing people from seeking treatment?
Yeah, I think that, it's a topic really, thankfully, a national topic right now. Just in general, there's mental health, there's a lack of mental health providers for everybody. And there's definitely a lack of mental health providers specifically for this population, trained specifically for perinatal and maternal mental health. So I think #1 is a lack of providers, that accept insurances, especially Medicaid or, insurances that for lower income people, lack of providers that take sliding scale or, low cost insurance. Also lack of providers, a diversity of providers. So if you're someone that wants to seek therapy, I try to tell you, you kind of have to shop around, right? You have to find the right fit, or therapy is just not going to work. It doesn't make sense to be sitting with someone that you're not comfortable with, that you don't feel like you're going to be able to connect with. Therapy is just not going to work. So having an option of providers that, oh yeah, this person, I have someone in mind. I'm going to try, I want to see a woman, blah, blah, blah. I'm going to try this person. Oh, she didn't work. I'm going to try somebody else. Just having a lack of diverse providers as well. And we've talked, we talked about this before, childcare. Nicole brought up transportation, getting to appointments. Luckily, because of the pandemic, the one good thing that came out of it is, having a virtual option for therapy and appointments like that. So that, especially with new moms, having to, get childcare or get that baby or on their nap schedule and get out of the house and, getting everything ready, especially if you have more than one child. So transportation can be a barrier, especially, and some people do want in-person appointments as well. So, and that makes sense as well. So transportation could be an issue. And just providers having a, lack of screening for maternal mental health conditions. I know the OBGYNs at Sinai, they screen for it because I know that, and they're aware of it as well, but it doesn't happen everywhere. And I do, our program gets calls from people that say, I talked to my doctor and they said, oh, you just need to get some more sleep. And I'm like, oh my gosh, no. How far along, how long in your postpartum period? And this is getting, all the questions. So some of the providers, unfortunately, aren't aware of, how to treat and what to look for. Luckily, it's more, awareness, and people are talking about it more. So hopefully there's more training and things like that don't happen as often.
So let's move forward to the impact of race when it comes to maternal mental health. Now, here's a stat that was shared. It says almost 40% of Black mothers and birthing people experience a maternal mental health condition. They are twice as likely to experience a maternal mental health condition, but half as likely to receive treatment. How does systemic and interpersonal racism impact Black mothers and birthing people's mental health? Nicole, do you want to jump in?
Sorry about that. Sure. Yes. I know we've touched on some of these already. Shelly touched on some of them as well. We know just from looking at maternal health as a whole, when we just look at the stat of that Black women are 3 to 4 times more likely to die during childbirth than their white counterparts, we already can see a bias there, systemic and interpersonal bias that is happening where women of color are not being listened to, their concerns are not being met where they are. There's an automatic assumption about women of color, and all of that comes into play not only for the physical treatment during pregnancy of the actual OB care, but it's no question or it's no surprise that translates also to mental health care. It's those same social determinants that we look at all of the time that make it more difficult for women of color to receive the treatment that they need or to gain access to it. And I simply loved what Shelly said about connecting with therapists and there being enough therapists and counselors of color in this field with this specialty. On the hotline, we have a directory that we can refer to of mental health professionals who've had some level of advanced training in perinatal mental health. And we definitely are looking to increase the providers of color as well as those who accept Medicaid. And so those types of issues are going to create just systemic barriers as well as sort of interpersonal barriers in moms getting the treatment that they need. And then I'll still go back to the cultural piece too as well. I mean, I don't think any culture glorifies maternal mental health conditions. But I do think that especially in the Black community, because there's always had to be this sense of we got to keep going no matter what. We done been through slavery. We done been through reconstruction. I mean, we just keep going and going and going. And the self-care and the sense of having other people to care and to care for you, that can also just really not be a priority or not be made a priority. And sometimes it can't be, because sometimes mama got to keep working. Somebody got to work. It doesn't even, sometimes it's not really even an option for women of color to take care of themselves. So we've just got a lot of work across the board to do with this. But I do think maternal mental health can be a way that we can kind of bring more equity to the playing field, because just like Shelly said, you can put a group of mothers or birthing people together that may have nothing else in common. But if they've experienced a perinatal mental health condition and all the challenges of going into motherhood, they're going to connect over that. And so this can be, to me, one of those unifying issues that maybe we can see changes across the board for all birthing people, especially here in America.
Crystal, can you talk to us a little bit about For Dope Moms and what you're running into when it comes to, the racial barrier that's out there?
I know personally for me, like Nicole said, you want to make sure that you have doctors listening to you. And it was last year, I had a friend from Morgan State University. She actually passed away after giving birth to her daughter. And when you don't have a doctor listening to you, I think to feel dismissed, it's just another level. I had that, and I went through that with my first daughter, Kennedy, and I'm a NICU parent as well. My daughter was born at 26 weeks, and it was something that I did not see coming, something I did not prepare for, but I voiced, it was my first pregnancy, and I talked to my doctor saying, my hands are swelling, or my feet are swelling, or I feel like I'm more sick than I should be. And she would say things like, oh, that's normal, it's your first pregnancy. I didn't do the research as I did with my second daughter of trying to find a doctor that I felt like that was my best friend. I want to have a doctor that I can call and talk. I know doctors are extremely busy, and I know there's a shortage too as well. So that you want to make sure you have a doctor that sees you and they're hearing you and they're listening to you. But I didn't have that in my first pregnancy. And so with other mothers that I do connect with in For Dope Moms, they have the same experience. They have doctors that are not listening to them. And just like as mine, I ended up having my baby early at 26 weeks. And it became, I didn't want to have children after that because it was a traumatic experience for me. And even having to leave my baby in a hospital after having her for the next 2.5 months, that was something that I was not prepared for. So I know it's not just the doctor's job to try to educate us on all these other things, but building a community, which I'm doing with For Dope Moms, and having women express and connect with telling their stories to each other. I think that's important to help us there's a lot of work to be done. I see a lot of new campaigns and new organizations coming, and we have a long road ahead of us. But if we can continue to have these talks like this, I think it'll help a lot.
So let's move into the impacts of COVID-19 on perinatal mental health. A lot of women were in the hospital giving birth and they didn't have support. They didn't have their partners. They didn't have someone there to coach them through it. Talk a little bit, whoever wants to jump in on this one, what were the effects of COVID-19 when it comes to maternal mental health?
I remember being in the hospital when it started, and I distinctly remember one of the nurses, it was probably May 2020 or March 2020, looking at me and saying, you're going to get the most calls. This is all going to hit all those moms that you work with. And it is so true. I mean, just piggybacking on what Crystal just said, as far as, it's not a solution to have somebody advocating for you because your provider should be listening to you anyways. But think about, not having any, when you're getting a medical procedure, something done, you're vulnerable, and you're more vulnerable if you're pregnant and you have a baby or you're delivering, and not being able to have somebody to support you during, in the hospital, during, going to your appointments, or during delivery. I mean, it's unimaginable. And then just speaking to that, having someone to support you and speak for you if you're worried about saying something, or just being the extra voice, like, wait a minute, they're saying they're feeling this. Let's, or, your mom, a girlfriend, somebody, I'm going to get the nurse. Something's up here, just having that extra advocate. But yeah, as far as impact on mental health though, we got a lot more calls during and after COVID. I think it's affected, as we've seen in studies, the whole population, has affected everybody's mental health. But just we've talked about that today, just having that support is so important, and just not being able to have any support, or being afraid to go out, being afraid to have people come help you with your new baby, being afraid to go to doctor's appointments, being afraid to go see cousins, being afraid to have visitors. Being afraid you're going to get COVID, your baby's going to get COVID. We didn't know, right? COVID was new. So people were learning as we were going, and that affects mental health. And maybe Nicole can speak on it a little more, as far as she had talked about it before, is, differentiating what's anxiety that's okay to have. Most people were worried about COVID or anxious about COVID, but when does it become a diagnosis or, symptoms of anxiety? So I don't know if you want to jump in, Nicole, about that.
I think you said it perfectly, Shelly. This pandemic just brought on so many things and worries and concerns. Like, what could you really call postpartum anxiety? Like, who wasn't anxious after COVID and all of the pieces that came with it? And it really, I call my pandemic parents, my heart just breaks and goes out to them so much for all the reasons that Shelly said, many of them being in the delivery room by themselves. That's a trauma in and of itself. And then all the things that she named afterwards. And another one that, even when we saw the immunizations come out, then it was the choice of, do I do this for my baby? Do I not? Do I take it when I'm pregnant? Do I not? It was just a never ending cycle of things to be concerned and worried about, anxiety, which can of course lead to depression. It was just ongoing. I've spoken to those who have called in where they felt like they made it through the pregnancy, the delivery, and then they had family come to help, and family brought COVID, and the baby got COVID, and the mom got COVID, and everybody got COVID. Now everybody's sick in the middle of the pandemic. You can just imagine the amount of stress that brings. And so we are still seeing the effects, even for families who may have kept their children in to protect them. I know a mom now whose toddler, she's worried about his speech being delayed because they really were protective in keeping him in. So as you're on the front lines, home visitors and community workers, you're going to be seeing these things in real time. And you're going to be able, I think, just to provide some guidance and empathy, and even just validation. I think a lot of the pandemic parents may be getting dismissed of, okay, well, yeah, you had your baby, I had my baby. But to really just acknowledge that had to be super tough. And I can only imagine what it was like bringing a whole human life into this world during a pandemic of the likes of which we had never seen. So just providing that validation, I think, is something that we can do now, and that we'll need to continue to do as these pandemic babies and pandemic families grow older.
Thank you so much, Nicole, for your comments. So let's move on to the role of partners when it comes to maternal mental health. How important is it for your partner to be informed in this space? And then also, what are the direct effects that you've seen when it comes to dads in this space?
I'll go. For me, and shout out to my fiance, he's on, and I'm so happy that he's on. And I wish there were more men on as well today, because this is a topic that they need to talk about and discuss amongst each other as well. But for him, this was his first time seeing me like this. So he didn't have any idea of what I was going through. And I think there should be more organizations and classes, even when we're having those, before birth classes and everything, just having these talks with the dads separately to let them know that you might experience something as well. You might experience some type of anxiety or some type of depression as well. And also to have them know how to support the mom, because I don't think they know how to do that as well. So I know, Nicole, you may have more information on what dads could possibly do, or give us some more statistics on that.
I think you've done a great job, Crystal, in describing the sort of the support that is needed, and sort of just statistics wise, but the little bit that we know, there's a stat that 1 in 10 dads will experience postpartum depression or anxiety. But this, what we don't know and don't have studies for to have stats on would be for partners. This can, adoptive parents can experience postpartum depression. Of course, in these cases, the biophysical piece isn't there. That's true for the birthing parent. You know, part of these conditions is a combination of the biological, physiological changes that take place during pregnancy and the postpartum period, hormones going up and down, all of that makes an impact. But then there's also the social emotional part of becoming a new parent that both partners, both people feel, as well as the social stressors and the need for support. So that is why dads, partners, the non-birthing parent, whomever they are, they can go down as well. And one of the largest factors that can influence a dad experiencing postpartum depression is the mom going through it herself. So I love what Crystal said about our dads, our partners, the non-birthing parent, they can need support as well. And that's where that practical support, I think, comes in for friends and family members. Yes, the partner can be there, but they can only do so much. But that's where community can come in, friends, family, church members, whomever. And we need people to come in and do practical stuff and practical help. We don't need you to come and hold a baby and say, oh, they so cute. No. Come in. Can you wash some dishes? Can you sweep a floor? Can you bring a meal? Can I hold the baby while you sleep, while both y'all get some sleep? Like practical. Yes, Crystal, thank you. Sleep. Oh my goodness. That's the number one thing on the hotline that we try to increase for moms who are struggling. How can we get your sleep being a little better? If to help a family afford a doula or a nighttime doula or a post-birth doula. That's the stuff we need. Babies don't need all them clothes and all them shoes that they're going to outgrow in 2 weeks or a month. Put your money towards something practical that is going to help that family have some time to adjust and to rest and get some sleep. So we love our partners being, supportive, our dads being supportive. Again, I think as Shelly mentioned, it doesn't mean that just because your partner went through postpartum depression that you will, but we kind of need to support everyone that's in the picture and do that in practical ways that can make a difference.
Can we just put that clip of Crystal and Nicole and play it for like the entire world? So at baby showers, so everybody knows that, please.
Now, great information and great insights, because I know I didn't need all those clothes. Babies didn't even wear the clothes. Thank you so much. So let's start to jump into solutions. Let's talk resources and let's talk action. So the question I want to put out there is, what local and national resources can be shared right now to address barriers and support birthing people struggling with their mental health? Shelly, do you have any idea on resources?
Well, first of all, Nicole, the hotline, the maternal, mental health hotline, that was such a blessing when the funding came and that was approved. So having that, I was going to mention earlier, and Nicole had shared a graphic as far as, it was actually a training yesterday I saw. Providers can call and home visitors can call that number if they need resources. So if you're a home visitor or working with a pregnant or postpartum mom, or you're a partner or somebody, you can call that number and ask for support too. Like, this person I'm working with, I think they, such and such, or a partner, somebody calling, I'm worried about somebody, they can call as well and get resources. And like Nicole was saying, they have a list of resources and areas, you know, different states and all that stuff, since it's a national number. I always give that number out to everybody. And also Postpartum Support International, which Nicole mentioned. I give that website out to everybody. They have so much information on it. They've had online support groups before COVID. I mean, of course, I love Sinai support group, but they have a lot of support groups that are very specific to different things. They have a dad support group. You mentioned, you know, for partners, they have a support group for partners. They have specializations for different, you know, postpartum issues and pregnancies and fathers and things like that. They also have a list of local resources as well.
Anyone else want to jump in with resources, Nicole?
I just concur with everything that Shelly said. And yes, you're exactly right. We have providers call our hotline all the time. Though we cannot provide direct diagnostic care or case, we say you're the expert, but we are willing to give guidance and willing to give resources that can be helpful for individual cases and patients. The directory that we're able to use on the hotline, it actually is Postpartum Support International's directory, and it is on their website, which is postpartum.net. Now, and it has the ability for you to put in a zip code, and then in some cases, an insurance. And then it will narrow down for you a list of maternal mental health specialists or providers. We can also sort by if there's a preference for a provider of color, if there's a preference for someone who's with the LGBTQ community. I really love PSI in that they have taken all of those things into consideration. And then just like Shelly said, there's over 20 support groups that they offer. They have a Black mom support group. They have an Asian mom support group. I mean, it just goes on and on. The dads, if you just want mindfulness, if you're struggling with anger, which can be another way that these conditions can show, they really have it together, and they're free and they're virtual, which makes it sort of a first go-to. It may take a long time to get in to be connected to a therapist or take some time, but we love being able to refer to PSI support groups directly. And I think I saw come in the chat that Nina has put together a whole list of agencies. The Maternal Mental Health Leadership Alliance is another great organization. I know that that's going to be on the list. They provide more guidance on national policy, but they also keep up with all of the trainings, all of the conferences, so that you all as community workers, as home visitors, if you want to go somewhere and take training or even become someone who has the specific credentials for treating maternal mental health conditions, that you would be able to do that. And I just want to shout out those who are sponsoring this, Be More for Healthy Babies. My understanding is that you all are doing a powerful work and have brought more equity to infant mortality rates for the women that you serve, women of color. That's major. That's absolutely major. So I'm not as familiar with those resources directly in Baltimore. But I do think that Nina is going to provide some, and I don't know if she wants to jump on now as well and share, but definitely the hotline and Postpartum Support International, they provide the overall resources and then break it down by state. And so it's a wonderful place to start.
Yeah, I was going to say, I think Nina's going to, because there are a lot of local resources. City, county, I see Jen on here. I mean, there are a lot. To list them all right now would be difficult, but we're going to provide that information for attendees after.
Wonderful. Thank you, Shelly. Thank you, Nicole. I want Crystal to jump in. For women who feel like they just want community, talk to us a little bit about For Dope Moms and your approach.
Yeah, so like I said in the beginning of this, when we started, for me, it was important that I find and build a platform where mothers like myself we can share what we were going through. So for Dope Moms, I started with having a small event, and it's still growing right now as we speak. But having those intimate conversations, panel discussions, and sometimes party. We like to turn up and have a good time. Having those type of events where we connect and share is very important. And like I said, healing comes in all forms. And I didn't, like I said, I didn't know this would come out of what I was going through as far as postpartum depression. So as for me, it's just important that I know that there are other mothers out there, learning and becoming knowledgeable of what is, the help and support that is out there. So again, like having these type of talks and having events where we can really share what we're going through is very important. So, yeah.
Thanks so much, Crystal. So let's talk a little bit. We talked earlier about cultural competency and cultural humility in treating maternal mental health. So what is the importance of these things and where do you see the growth?
Well, I think we've kind of touched on the importance. If we can just sort of just break it down to individuals, everybody wants someone that they can relate to. Everybody wants someone where there's no assumptions made about them off the top just because of the color of their skin or their gender or whatever you want to say. People just want to connect and want to be heard and want to have their concerns met with the same level of care that you would give your mama, your child. Everybody wants that. All humans want that. And so as we take this approach, in whatever part of the field that we're in, providers, community workers, mental health specialists, having that cultural humility, that cultural sensitivity to say, I'm not going to go into any interaction with any kind of assumptions. Yes, I know stats. Yes, I know risk factors. All that's important to be in the background, but I'm first going to be talking to this individual, this mom, this particular family, and what their needs are. And I've never met anyone when you do that sincerely, that they don't make a connection with you. And that's what I love about home visitors and community workers. You're often seeing people in spaces that providers or therapists will never see them. And so you're able to make that connection in a whole different way that others can. And when they see that sincerity, it just goes an incredibly long way. So I really just come down to, it's the one-on-one. It's the golden rule, is treating people like you want to be treated. That can be very powerful in helping us combat this issue.
So the final question that I'll put out to the panel is, how can we increase awareness? We have these events, we have our individual sites, our hotlines, things like that. Overall, if you had to, come up with your dream list, how can we increase awareness of maternal mental health and the solutions that are available?
I think talk about it. Just getting that awareness of home visitors, talking about it, maternal mental health in general. We all have mental health. We all do. It's there. We all have a brain. We all have mental health. So how's yours? Like you have diabetes, you treat it. You have something going on with your mental health, you treat it. Normalizing, talking about it, especially with pregnant and postpartum birthing mothers, birthing people and mothers, talking about it, normalizing it. It's common, and get treatment. Just getting that out there, awareness out there. Just talk.
I agree with Shelly. Having those conversations, even, with your girlfriends, if you can talk about what you saw on a show, let's talk about how we really are feeling with each other. I think that's really important, and continue to have these type of events, like I said before, and making sure that we also, let ourselves and others know that we're not alone in these situations. I think that's the number one thing. We think we're the only ones going through these issues when we really are all in this together. So having those talks, like Shelly said, just continuously and continue to connect with each other. Yeah.
I concur with what both of them have said. I think my biggest thing on my dream list that preferably will not be a dream one day is to continue to address systemic and racism and bias. That would take care of so many issues that are related to health and mental health. And so all of the efforts that continue to try to continue to make that happen, whenever we as professionals can take trainings to try to make us aware of our own biases, just because we might even be a person of color doesn't mean that we don't have biases ourselves. So I really think that if we could address and can continue to address, that would be my dream. If we could eradicate it, of course, that would be lovely. But we live in a real world, but the more that we fight to gain greater health equity as a whole, I really think that not only maternal mental health conditions, but maternal health as a whole and so many other well-being factors would be increased.
So now I'm going to turn it over to Nina and see if we have any questions in the chat.
Thank you, LaDawn, and thank you to all the panelists once again for just doing such an amazing job and being here today and holding this conversation and the space for this. We have a few questions, and I welcome any more. If you have questions, please put them in the chat, and we will get to them. We have one question from Tamira Dunn. Have you encountered moms that reach out for support that are pregnant after a loss? What has that experience been like?
I can jump in with this one. I definitely have. On the hotline, we receive a large portion of our calls are those who are struggling with infertility or that they've had a loss. And oftentimes what they're dealing with is just all the triggers that come from the experience of their loss. And then if they're pregnant or they have a child that got here successfully, the feelings of guilt, the feelings of should I have done something differently with my other pregnancy, all of those things. And what we find more often is that these persons have never had a chance to process the loss. When they had the loss, either they may have never even told anyone that they were pregnant to start with, or it was just, oh, well, you can have another one. And, oh, well, those things that we say that are kind of dumb, but some people say to people anyway. But they just almost need a space, just to be able to do that. I would say even as just as there have been definitely some calls, I think I'm not going to give the examples of extremes where women have really gone through extremes in trying to hold on to or have some memory of their child that they may have lost. And they feel so guilty to be moving on to parenting another child. And they just really don't know how to handle that. And just having a space to speak to that and for them to pour out what they never have processed can be really helpful in those situations. And Shelly, I don't know if they're in the hospital, you may even see from just the OB side of women who have difficulties, carrying to term, and just they're so afraid of the physical things that can go wrong, all the way up from a child loss, and then how are things going to go with a current pregnancy? I don't know if you can speak to that some, or if some of the women in your group may have shared.
Yeah, really similar to what you said. If you think about it, anxiety, a lot of anxiety, and it's everything, like pretty much anxiety throughout the whole pregnancy, right? With a pregnancy after loss, is this going to happen again? Is this going to happen again? Can I get past the so many weeks where and oftentimes the anxiety doesn't subside after delivery. So just, paying attention to that and talking to people about that and what to look for and signs and symptoms. So very similar to what you experienced. We do have, Baltimore does have local resources for that as well. So we could send those out as well. But there are, pregnancy after loss support groups local to Baltimore in the area as well.
Yes, and PSI has several child loss support groups, infertility and child loss support groups as well, free virtual ones.
Nina, do we have another question?
Yes, we do. But before we move on, I just want to do a quick shout out to the Hope Project. And they are an organization that provides support to moms, and they have support groups for those who have suffered a loss. And we'll share that in a follow-up email after how to connect with Hope. One other question we have is, what are some things that people said if you were experiencing postpartum or perinatal anxiety? What did people say that were helpful? And what are some things that people said that wasn't so helpful?
Crystal, as our person, survivor, when you want to jump in there.
Yeah, let me think. It was, so for me, you know, I don't live where I have a lot of family support. I do have some family support here. But you know, some things that were not helpful, you know, with my provider that I did have with my first pregnancy, saying things like, this is normal, or you'll be okay, or you'll get through it. Those are things that were not helpful for me. And I really didn't know at that time. I was uneducated and didn't really know what I was experiencing during that time. So I didn't have those support groups. I had to kind of just go online and try to figure out what to do and try to see who I can connect with. But if you are with someone that is experiencing any of these issues, you know, I think you should do your own research as well to try to figure out how you could be supportive to someone that is going through this, and try to just, you know, be kind and patient, because it takes a long time. Everyone has, you know, a different time frame with their healing and what they're experiencing. But for me, having those comments where it was like, oh, there was this one I can remember after I had my daughter, a nurse actually said to me that I should be feeling a certain way after my recovery should have been faster. And I'm like, no, you know, this is new to me. This is something I don't even know what I'm going through. And I'm learning it on my own, you know? And so trying to have someone, you know, speak to you with they're trying to get you through those situations a little faster, that wasn't helpful. That's not helpful for me. It wasn't for me.
I also think that this is true for whether mom is experiencing something or not. Giving baby advice and what you did with your child and what your experience was like, if the person don't ask, don't say it. That's generally not helpful. That's just true across the board. But what Crystal said, we hear a lot on the hotline that people are minimizing when moms are finally getting enough courage to say, I think something is wrong and something is not quite right. Oh, you'll get past it. Oh, you'll be better. Things will get better. One of the most helpful phrases I think can be in the world is, how can I help you most in this moment? How can I help you most right now? And really listen to that, what person says, and then try to really do it. Try to really help them. Because we just don't know where people are. We never know how much courage it takes for a new parent to even express that something is wrong. Because remember, they're supposed to be happy. It's supposed to be the happiest time of their life. So if they've got enough courage to tell you, I don't think something's quite right, validate that and ask them, how can I help you most in this moment?
I love that, Nicole. Nicole and Crystal, thank you so much for sharing. So what I want to do is give the panelists each a chance to tell you how to get in contact with them and their resources. So Crystal, I'll start with you.
Sure. You can log on to Instagram and go on to @ForDopeMoms, also ForDopeMoms.com. You can also reach out info@ForDopeMoms.com if you need to send an email to me as well.
I'm going to write Crystal's down now for the resources that I give out. My email is going to be shared, so somebody can email me if they have any questions or concerns. Sinai does have a perinatal depression and anxiety outreach program. It's on pause right now because we're trying to hire someone for it. But I used to do that, so I'm still fielding those calls and still helping people right now, and would love to provide, you know, if somebody reaches out and needs some resources or something like that, please send me an email.
And I do think Nina is going to provide our contact information that we said that we were willing to share. My email address will be in that, as well as the web links for Postpartum Support International and the National Maternal Mental Health Hotline. So those are always, I'm more than happy to reach out. This is just one thing that popped in my mind that I wish that I had maybe said on one of the other questions. But another thing that I want to say, for those of you who are home visitors, community workers, one of the other major things that you can do is if you have a birthing person who is already on some type of medication for maternal mental health, is to discourage them from simply stopping the medication without talking to their provider first. And we are not medical providers. Even on the hotline, I cannot tell a person what to do, but I can direct them to their medical provider. But one of the things we see so much when moms start going downhill is they were taking something and they stop it just because of pregnancy. And what we can say that is true is that research shows that it is more beneficial for a pregnant person to stay on their medication than to stop. The outcomes are worse for stopping. There are only a few medications that research shows that are contraindicated for both pregnancy and even postpartum. So if you can even just do that, just tell people, hold off, don't quit taking your stuff now. You're doing well. Let's not mess up what you're doing well on. Talk to your OB provider or a psychiatrist that is schooled in psychiatry for pregnant and postpartum women, because in most cases, what we're seeing, at least research-wise, is that it is less beneficial to health. There's way more risk to mom and baby for stopping medication suddenly, especially, than it is for them to stay on and if not increase it during pregnancy. So I just wanted to drop that tip in. My pastor often says, if you don't remember anything else today, that's something that you can remember to do.
Thank you so much to all of our panelists. Once again, our panelists were Shelly Bray, Crystal J, and Nicole Barnett. Thank you so much for joining us. Nina, I'll turn it over to you.
Thank you so much, LaDawn. And thank you again to our panelists. Just tremendous thanks for you all being here today and for the work you do. And thank you everyone who attended today, shared questions, shared ideas, shared resources. Thank you so much. Please look out for a follow-up email that will include all the resources that we discussed today and more. And the evaluation link is also included in our chat and will be in that email as well. And we appreciate you filling that out if possible. Thank you all. And I hope everyone enjoys the rest of their day and has a great Memorial Day weekend coming up. Thank you.